and Dene. The beautiful building we are hosted in today at the Acton office, located in Fort McMurray, is proudly owned by the Athabasca Chippewa First Nation. Thank you, Acton and ACFN, for providing the space for today's conference. I would like to start with a few courtesy and protocol items. We have supporters and community members here today. Topics we are here to discuss may be very difficult to hear. If anyone is feeling they need a quiet space to reflect, we have private rooms available and support staff here to speak with if you need. Following the presentation, there will be a question and answer session with myself and the panel of chiefs. Please reserve your questions until after the presentations have been made. I will introduce the Q&A moderator to host the session. Community members online, if you have any questions to ask, please enter them into the comment section. And if there is time, we will try to answer them, and we will follow up with any questions that have not been answered during today's press conference. I would like to start the day in a good way, and I would like to invite Elder Roy Lattiser to come up and provide a prayer in Cree. Elder?
Nós como não do tema, a nós que chegou muito a mamo pai honuma, a o mache pai goma, ka kiu eu che kamio pai. O tau no se mantu ki chu ma te pe chigat. Ka tamago siak. Mam tu nei chegano ma ko eso na nas tamago ya. Tan si so che mamo.
Thank you, Elder Roy Lattiser. I would like to now invite up Elder Agnes Duke to provide a prayer in Dene. Thank you for the prayer, Elder Agnes Duke, and for starting us in a good way. Now, for those that are unfamiliar with ATC and what we do, I'd like to explain a bit. ATC is an organization that provides essential services and advocacy for our First Nation members. The members of ATC include the Athabasca Chippewa First Nation, Chippewa Prairie First Nation, Fort McKay First Nation, Fort McMurray 468 First Nation, and the Mikisew Cree First Nation. Each nation is represented by its elected chief and council on our board of directors. All 5 of the First Nations ATC serves are part of Treaty 8 in Northern Alberta. Today, we refer to the 5 First Nations we serve as ATC First Nations for simplicity. Each First Nation is a sovereign nation, and ATC recognizes and respects each nation's governance. I am joined here today at this press conference by ATC's Board of Directors, ATC Board President and Chief Alan Adam of the Athabasca Tribal First Nation. We also have Chief Vern Janvier of the Chippewa Prairie First Nation, Chief Neil Cheecham, Fort McMurray 468 First Nation, and we have Chief Billy Joe Tuckaroo of Mikisew Cree First Nation and Chief Raymond Powder of Fort McKay First Nation. Both were not able to make it today, but both send their regrets and support all the communities and the efforts underway today. Also joining us at the Chief's panel table is Chief Arthur Noski, Grand Chief of the Treaty 8 First Nations of Alberta. We are also joined today by supporters of our nation and our communities. We have Mayor Sandy Bowman, Regional Municipality of Wood Buffalo. Thank you for joining us here today. And I'd like to also say welcome and thank you to all of the elders in attendance. I would like to thank the members of the communities who we serve who have joined us today, both in person and watching online. Many of you have been impacted by tragedies in the recent months and weeks. Thank you for the strength it takes to be here with us today and for the resolve you have to fight for a brighter future. ATC is here to fight with you, beside you. Now, I would like to invite Chief Alan Adam, President of ATC and Chief of the Athabasca Chippewa First Nation, to speak about what has brought us all here today. I'd like to just remind everyone to keep your questions until all of the presentations have concluded. Thank you.
Good morning, everyone. Welcome to the press conference here today that's going to be put out by the Athabasca Tribal Council, which I am the president of. Today, I'm here to represent the Athabasca Tribal Council as the president of the board of directors. The Athabasca Tribal Council First Nations are in crisis. And the reason why I say that is because of the opioid crisis that we're having within our community. Since January, we've lost roughly over 60 members from our communities within the Athabasca Tribal Council. We were supposed to do this press conference in June. Back then, we had over 30. And over the summer months, we've lost more. I myself lost a brother and 2 nephews within the last 3 months. And it continues to happen. We just buried one 2 weeks ago in the community of Fort Chip. And I imagine Chief Vern also just buried one last week as well too. And the crisis continues on a weekly basis. It does not end. This is more death in the ATC First Nations than was reported as the result of COVID-19. In the pandemic alone, we probably lost maybe 2 or 3 people with the pandemic of COVID. 60 members alone, just by opioid crisis, is something different. Generations of unaddressed impacts of residential schools, traumas, and cultural oppression has created a long-standing of mental health crisis and feeding the addictions. And these are the things that happen when there is no help available for anybody. When you have trauma that goes with you and you don't talk about it, and you have to feed it. And if you feed it, it all depends what you get out of it. The struggle was made worse by disasters with another flood, fires, pandemic, and now fires again. We are standing here today to tell our community members that we are taking action. We have created a task force made up of members appointed by each nation. Chief and councils are made up of community members, healthcare professionals, and other community supporters. Under the direction of ATC Board of Directors and the Chief and Councils, the task force will set out a strategy to provide immediate and long-term sustainable solutions. We have communicated this regional state of emergency with provincial, federal, and municipalities. We have met with Indigenous Service Canada to receive initial funding, but it is not enough. We've discussed collaboration and partnerships with multiple governments of Alberta ministries, including Indigenous relations, mental health and addictions, public safety and emergency service, and the Ministry of Senior, Community and Social Services. The RMWB Mayor Bowman is here to support us for our community. Thank you. We have connected with nations of elders and hosted elders' wisdoms gathering. We are going to use their teachings to understand how to address the crisis using cultural ceremonies, language, healing, and land-based connections to live in a good way. We have initiated the steps to having multiple mobile outreaches support crisis teams who can respond 24/7 to provide immediate in-person assistance to those in crisis. We have been working with the RCMP and the Alberta Health Services to roll out the virtual opioid dependent program in Fort Chipewyan. This is a program that will allow RCMP to offer individuals in their custody immediate access to a recovery program that includes administration of medication that will support the addictions of treatment. We have and will continue to explore community security and policing alternatives. We have seen a rise in drug-related violence, and this is traumatizing our community members. ATC First Nations are sharing successful strategies with each other. ATC has provided barriers-free access to mental health support both in person and virtually. In Cree, Dene, and English throughout the community, partners and organizations have specializations in counseling. We have done and will continue to do everything in our power to support our communities, but we are far from seeing success. This is not a crisis that has started with a root cause. This is a tragedy of multiple inadequate band-aid solutions over generations. That is why the Athabasca Tribal Council and the Board of Directors that I represent are declaring a regional state of emergency as a result of the mental health and addiction crisis. We need the federal, provincial, and municipal governments to step up and work with our communities that are already doing the work. We need funding to deliver a target, effective, sustainable, and local-led response to this mental health and addiction crisis. The task force will guide ATC to develop a regional community action plan that will build on the actions we have already taken. They will focus on community safety, policing, and security. Support families who are struggling with the day-to-day impacts of addictions. Create community-led wellness teams. Support community members who are ready to heal and able to provide a detox and treatment immediately and support their long-term journey. We must also look beyond the healing recovery and must provide the programs, training, and support needed for community members to have a future. We must have the oil sands industry commit a stronger policy that protects the land and the communities that we live in. We must have industry strengthen partnerships with our communities to increase access to cultural safety, healthcare, and provide training and career opportunities that benefit and provide hope and a sustainable future for our families and for the whole community. We must collaborate from all industries, agencies, departments, ministries, and governments to take a comprehensive approach to healing our communities. ATC First Nations are strong. Our people are resilient. Our First Nations working with ATC have demonstrated our ability to work together to implement strategies and services in the face of an urgent health crisis, as we did during the COVID-19 and as we did during the 2023 wildfires. We own it to our communities to take action to make them feel safe and strong. We owe it to those who have passed into their legacy of the motivations for healing and the change in our communities. We owe it to their families and to their children to do better. We owe it to ourselves to make a future we thrive in and not to suffer daily. By declaring a state of emergency today, we are just doing that from the Athabasca Tribal Council area. I'm Chief Alan Adam from the Athabasca Chippewa First Nation, and this is the message that we provide today.
Thank you, Chief Adam, for those powerful words. I'd like to introduce Chief Vern from the Chippewa and Prairie First Nation.
Mercy Cho. Do last inch adala order hilela sananaga. Sa quest longe. Sinus in la. Do dan di yahidala. Pa adharlu no halot in besto sheha. Nahida dai ao, nahidat saa. Si sano ho unas anda. Du hidala du. Ayika. Dori kela order detle. Da godin nadu. Da no hanarna dio, da no hanana de dalana. No hanano ti samba sahil chula. Pa asida unas anla nuni. Nuni ba ada diet ana ye. Adri no hanana. Dana hal da gadel chula. Dana hal dana zade dio. Har you janok and nanaga. Pa adat e nala. Nuni ba athage dela. Ayika no habaya hula da dahide hag odera da chana khani delo sidana da adani tiaja ayika no hajada di hadandori kenda ay hani delanda du zinaga ja punt ilada tharlu nanaga basto shed harlu dana aja ja du gane deo Canada obligatlad dana da dai anda. No new clean like holy tot ina the banana the kont ana. Nini that and saduna nea ayika. The diet Good morning. I'm Chief Vern. In my language, I said a few words that I've been chief for 17 years. But since a child, I've watched. My father was a chief. My grandfather was a chief. My friends were chiefs. My uncles were chiefs. And I was raised in a traditional way. I was raised on the trap line. I seen my father and my grandfather make money in many, many ways. But today, we live under this Indian Act. The Indian Act is an act that is a racist act. It was made to keep us under control. As chiefs, we have our hands tied under this act. We could do a lot more for our people, but every move we make is controlled by the Indian Act. And in some countries, it's called puppet governments. In Canada, us chiefs are the puppet governments. We're the puppet government of the government of Canada. We are powerful in our community. Our people still follow us. They respect us. They respect the position of chief. We will always survive. We will always live our way. And we have for many, many generations. But today, we're facing a challenge that is very, very dangerous to our people's survival right now. The challenge is of the drugs, of the alcohol, of the non-employment, of the racist system. That system is beating us today. We all live in the communities, and even the communities up north are having the same troubles. It's because the people feel the effect inside their spirit. Their spirits are dead. The reason our people do the drugs is because they're trying to keep their spirit alive. The reason they drink is because they keep the spirit alive. We as Indian people learn to live off the land everywhere we go. When you see homeless people on the street, it looks bad, but it's our traditional way of living in the land also. But yet, the system is killing us. And, you know, the other day, I went to a meeting with one of the big oil companies in this region, and I asked for $2 million to support our basic needs, to feed our people, to make sure the houses are protected, to make sure that we have a police force that's going to help us, that understands us, to make sure that we can keep a roof over their heads. The level of the rules to get a job in this industry is gone out to the point where we cannot employ, where we cannot get the jobs. And in that same sentence, when I asked that lady for that money, in her next presentation, she explained that their company had made $2 billion this quarter. That is only one company. These companies make billions of dollars in our land, the land that we have protected for many, many generations. Now we can't even go to work there. But for their shareholder, they say billions and billions of dollars they're making profits. But yet people are the people that have caretaken this land for generations are dying off like genocide. We've been put to genocide through the residential schools, through the child welfare system. They've been killing our spirit. They've been killing our system to try to wipe us out, to get rid of the Indian problem. That system has never died. That is alive today. Today, we have people that come across from the country, from the other people across the oceans, and they say, you Indians should be happy, at least you're not getting killed like they do in our country. But that's not acceptable for us because this is our country. This is where we live, and this is where we're born, and this is where we die. But all we're asking for is for some fairness so that we can support and look after our people while we go through these crises, while we go through this oppression. We're going to go through it for a long more time because the system exists, this racist system, and it will not die. That is why that we have come to this moment in time where all the leaders are at a point where they say we are in a state of declaration, the state of emergency, that our people are in need and we need to help them. You know, our young people are dying unnecessarily because they just can't take it. Their spirit is dead. And we can survive our own people. We do our own things in our communities. At home, we have a farm. We We grow potatoes, we raise cattle. People still live off the land. We look after our people, we school them, we educate them. But that's our way. And we're perfectly okay doing it. But we need the help from the outside world, the industry, the governments, so that we can keep living our way. And for the ones that are fortunate enough to go out into the society and thrive, but we still need half of our generation to go stay in the bush, to live the old way, because we can never let that go. One day this earth will return back to that way, and we need to be prepared for that. That is why we don't lose that way ourselves, because we never will be able to live in this society when we run out of food, when we run out of money. So we are always prepared for that day. But today, our populations are growing, our people are growing, our nation members, just our nation alone, we have members across the ocean. We have members across Canada, across North America. And that's something we're proud of also. We have people in universities. We have people graduating with degrees in engineering, studying to be doctors. And yet we're also proud that we have members that live off the land. So, but today is about declaring that we are in a state of emergency and we're needing support to keep our people from getting wiped off this face of this earth. And it's embarrassing. It's a failure for the people of this country, for the governments of this country, this province, and the industry in 3 months that make probably the equivalent of $20 billion in 3 months in our land. And all we're asking for is a couple $1 million to help support our people. And our people are, we've always been happy to share this land. We've always been happy to share the resource. And we will continue that way. We will still suffer for everybody's pain because that's the way God put us. And I hope that today that, many people listen, our own people, that responsibility lies on everybody's hands to make sure that you don't see the next person suffer beside you. That is all our responsibility. So with that, thank you very much. Have a good day.
Thank you, Chief Janvier. I'd like to just remind community members and members of the public that we have team members here today to support you. If you need a quiet space to reflect on anything that you've heard, I've got a number of my team members in the audience. Please feel free to reach out and connect with them, and we'll make sure that you have someone to support you. I would like to now introduce everyone to Grand Chief Arthur Noski, who is the Grand Chief of Treaty 8. As a well-respected former chief of Loon River First Nation and a known advocate for Indigenous rights, Chief Noski has worked diligently to bring unity among Treaty 8 nations. I would like to welcome Grand Chief Noski to the podium to bring a few words on behalf of Treaty 8.
Again, we're going bringing this up again. Sorry. Thank you, Carla. Thank you, chiefs. And I know this is a hard place to be. And I just want to paint a little word picture for you. You see the changing of the weather today. And, you take a late drive or an early morning drive. You see the fog descending and ascending the more time you spend out there. We grew up in that environment as children off the land. And some places you have well-beaten paths of frequent travel. Some places, the sensitive areas, there's trails that are overgrown. And when the fog descends upon that place, you do not recognize where you are. So we were taught as kids Don't go into the fog. Don't run into the fog. Wait till it lifts. You wait till it lifts, and then you will find your way. You know, what's happening today is part of the ongoing mental health and addictions crisis taking place nationwide. While we recognize that this is a struggle faced by many, for Indigenous peoples, these mental health and addiction battles are a result of unhealed trauma from the colonization, the impact of the residential school system, and the suppression of cultural practices. The healthcare funding and support for our communities is managed differently than for the non-Indigenous Canadians. Our communities continue to struggle due to the lack of local, cultural, relevant, and safe resources. For many First Nations, resources are not available within home communities, and many have to travel hundreds of kilometers away from their families and support systems to access care. I support the unity of the First Nations that this region shows through the Athabasca Tribal Council. Treaty 8 is here to advocate and support the First Nations and ATC in their calls for the governments to step up with these communities. Treaty 8 supports their demand for action, supports resources and partnerships immediately to save lives. Going back to that fog, people in addictions do not have that sense to wait. They just venture on, looking for the next fix, because there is no help available. So I challenge you and encourage you as a collective. Let's work together to send a beam amongst that fog for them to see that there is help here. Hey, hey, Marcy Cho, thank you.
Thank you, Grand Chief Noski, for those powerful words. The Athabasca Tribal Council has a mandate from the chief and councils of the communities we serve to address this urgent mental health and addictions crisis impacting the communities in this region. This means we have a duty to raise the alarm with the government and with the public. The mandate that we've been provided, have been provided directs this task force to be a community-led process, and it has been appointed by many different members from the leadership. Our task force includes CEOs and band members, band managers, health directors, and support staff, directors of emergency management. We have members from the RCMP, Noonie Health. We have members from a group called Aunties Within Reach, many government and community communications professionals. We have community-minded businesses such as Medica North, who are standing alongside with us, and representatives from the Missing and Murdered and Exploited Indigenous Peoples Task Force. This group of people have a significant challenge ahead. The trauma that our communities are facing were not created overnight. The answers that we need to have and the solutions that we need to have in place at a community level will not be done overnight. But they have a mandate, they have a task at hand. So this task force is going to be working on the following items. They will be reviewing an action plan and confirm tactics with each First Nation and ATC. They are going to be working collaboratively to understand the current situation of each community, to identify strategies and programs to be explored and to be implemented on a community-led initiative. Our individual First Nations will be continuing to share the successes that they have, the approaches that they are taking that are right to serve their community members, and sharing those lessons with each other across the region. They also will be working with the leadership to keep them informed on the progress that the task force is taking, the feedback that they're hearing from community members, from elders, from our youth about what is working, what it is they need, what are the safe spaces that they need at a community level. ATC is determined to find solutions on this regional crisis. While the mental health and addictions crisis is one faced by communities across this country, the challenges are made worse by the challenges we face in the North. Our nation's remote locations with limited access to culturally safe, appropriate healthcare often makes healing that much harder. The history of Indigenous people in Canada is one of resilience in the face of overwhelming challenges and trauma. Trauma that has left Indigenous people vulnerable to mental health crises, often without the support they need to heal. As you've heard from the chiefs today, we're also seeing a significant rise in violence and illegal activities by people coming from outside our region and preying upon those experiencing crisis who are desperate for some relief. ATC First Nations are strong. Our people are resilient. We have faced crisis in our communities before, and we will again serve our community members facing the urgent health crisis as we did during COVID-19. We will be exploring every option possible to get the services that our First Nations of the region need to heal and thrive in their home communities. This crisis is real, and the ATC Chief and Councils have committed to take action and not wait for the government to respond. If there are initiatives that this task force deems immediately necessary to implement, ATC or our member nations have committed to fund them directly, and we will, as our communities cannot wait for a slow, bureaucratic response from the federal and provincial governments. It is time for change. It is time for action. We can no longer allow our communities to suffer in silence without the support they need to move forward and start their healing journey. I'd like to thank everyone today for listening to our panel. And I'd like to invite Colin up, who's going to now assist us in moderating any Q&As that we may have online or in the room. Colin?
We will now take questions from media, beginning with those present locally in Fort McMurray and then those joining virtually. After the media, we will take questions from the community. Reporters attending in person, you are invited to approach the microphone. Please introduce yourself and your outlet before asking a question and up to one follow-up. As well, please identify your question if your question is to the whole panel or to a specific person on the panel.
Hey. Hey, so Vince McDermott, Fort McMurray today. I know it's been described that a lack of safe housing and healthcare and food security all feed each other and are also some of the many factors that feed into this addictions crisis. So I'm curious about the state of housing and food security in all of your communities today, especially after the pandemic. I'm just curious about just the state of housing and food security in all of your communities today, because I know that's been a longstanding issue, and it's also been cited as reasons that have also been feeding into addictions in many Indigenous communities.
Yeah, Actually, I'll just take the mic out. The housing situation in our community, like in Janvier, during COVID-19, a lot of people came home that have never been home for 3 or 4 generations. When I first became chief, we started building new houses, started fixing houses. And today, like we have one oil company helping us build housing. But with the young couples, single parents, we're still needing, I think, something like 50 units before we even come close to catching up. We've had a problem with houses burning, with fires. We've lost, I think, around 20 houses, Shane, Stacy, around 20, right? These are my counselors, Shane, Janvier, and Stacy Boucher. And they, so we're always falling behind as hard as we work, but you know, money is always the limitation. To build a house, to build the infrastructure, we're around $380,000. And Indian Affairs gives us 180. Yeah, $180,000 is what we get for our budget. So when you think about, we got 180,000 and we need 55 units. And each unit is costing 350. Do the math, right? It's hard to catch up. We have families that are growing. Every year we have kids that are born. So the further we fall behind all the time. No matter how hard we work, we have 3 or 4 crews fixing houses. We have 2 crews building houses. We have to find ways to fund that. We still do business. We still make money. But there's a lot of, like, I think a lot of misunderstanding is the difference between a community like Fort McMurray and a community on the reserve. There's a huge difference. The dependency system that's created by the act of the Indian, that has created a whole system in itself that we need to give people their own homes. We need to build their homes. We need to fix their homes. And that, like I say, right now, we're about 50 houses behind. For food security, right now, our food bill, Najwa, $200,000 a month to feed our people that need support here in Fort McMurray, in Edmonton, in Janvier, in La Loche. It's costing us around $200,000 a month. So you do the math, that's I think 2.4 million, right, in a year. So when you do that, and the Indian Affairs money between the health and Indian Affairs, I think we're at about $5 million for all of our operation. So that is why it's so important that we get more support. But as chief, my commitment is that every family has food, every family has shelter, every family has windows and doors, and their heat is on and their electricity is on. Every day we wake up with that headache. These guys share the headache. All the chiefs go through the same problem. And that's the state of the food security. We grow potatoes, corn, and onions. Last year, we harvested 240,000 pounds of potatoes. We donated 80,000 pounds through the region. My brother and I, just outside Walmart, in 2 days, we gave away 30,000 pounds of potatoes last year. And it took us only 7 hours total to give that away. So we know that people have food security issues all over, and with the cost of inflation, with the cost of everything going up, it's not only us that feel the pain. So, but that's kind of the answer I can give you, Mr.
I'm also curious, how often do doctors and addiction support specialists visit your communities?
We have a doctor that comes in once a week. Addiction specialists, what do we have? Once a week. We have people from Fort McMurray that come out, and they come to the health clinic. If you're willing to come get support, they're there once a week.
Thank you.
Hello, I'm out.
If you want, I could answer that question for you. You asked the question, how many times a doctor and professionals come to the communities? Each community is different. Because of Fort Chip, we don't have access by road. We're a fly-in, fly-out community. We have a doctor's crisis in the community where we have no doctors coming to our community. We don't have no physicians to help our people or give them some kind of advice about what's needed for them to get recovery. We have addiction counselors that are nowhere in sight because we don't have a program in the community because people are scared. People are scared because drug dealers are shooting at each other and they're doing it right in broad daylight when kids are around. When you get people that are trying to help and they see this, the first thing they do is they fold in. When leaders stand up to these issues, people have to stand behind us. And there is a crisis. There is a mental health crisis in our community. There is a shortage of doctors and professional help that is needed. And it's been doing this for a long time. In our community alone, we've been suffering with the mental health and the crisis from medical services, probably for the last 10 years I've known as being the chief. And all of our health issues leading up to the pandemic of the drug crisis stems from the health issues that happen within the community. If you don't have your health portfolios in place to protect your community, this will happen and continue to happen. The Athabasca Tribal Council is not the only tribal council that is in crisis, but we are taking steps to be the leading force to see what we could do differently within the country that we call Canada and the province that we call Alberta that we live in. And we're going to take the necessary steps to make sure that our people are done and healed properly, because we know from our experience what it takes to help them. We just need the courage from industry, governments, and other agencies to help and assist us. If you cannot help and assist us, leave this area and do not come back. Because your bringing here brought all these pandemics and these crises to our area. If you cannot assist, leave. And that's my message.
Hello, I'm Alex McLeod from Mixed News. My main question is, health problems were widely reported in Fort McMurray after the 2016 wildfire. I was curious how the Fort Chipewyan wildfire and evacuation kind of impacted your community as well.
You know, based on the experience from the 2016 wildfire here in Fort McMurray when everybody was evacuated, I just so happened to be on the plane that day when the fire broke out and took ravage over this community when everybody had to evacuate. My family as well got evacuated from this community, and I know the trauma that they went through. I had one kid, one of my daughters ended up in Lac La Biche. The other one ended up in Edmonton. We ended up in Fort Chip. When the fire broke out in Fort Chip over the summer, when we were evacuated, people were uncertain about what we were going to come home to. And because of the experience, what we went through here in Fort McMurray, we took action to protect our community. You got to remember one thing, guys my age that are around 50-something years old, we have experience in forest firefighting. That was one of our jobs. We are not in control of management of fires. There's a difference between fire control and fire management. Fire control is where people on the ground fight the fire. Fire management believes in the wind and the forces of Mother Nature that will carry the fire away, and that's what the government relies on today. And when the government relies on the movement of wind and everything, you got to understand one thing. When it comes to wildfires, no matter which way the wind blows, when that fire takes off, it creates its own wind, it creates its own storm, and it creates its own misery wherever it goes. There is no control of it. But when you are a man and you have to protect your community and you have no outside resources to protect your community, you have to stand firm with your community members and say, we are the ones that are going to protect our community. And we did that. We took a base of action because we knew the threat that if the fire came into our community, no government agencies will come to assist us to rebuild. Our community alone is probably worth over $1 billion. And when you look at the wildfires that went through the Northern Hemisphere, like the town of Enterprise, completely wiped out except 3 buildings standing. Could you imagine with the crisis that we're going through here today, if our community had burnt out? We would be more devastated. I would have to work in partnerships with Mayor Bowman, because already when the fire was ravaging our community throughout the outskirts of everything, I was making preparations with plans to talk with Mayor Bowman if the worst case scenario, if anything happened to our community, how would we house our people that were evacuated? These are the kind of things as leaders we prepare for. We don't only prepare for the fire that's coming, we prepare for other things that are outstanding. And you can't leave nothing out. And that's why we stayed home and we prepared and we fire smarted our community. We cleaned out everything. We cleaned out the trees. We took everything, all the garbage and debris from every outside of the homes and everything. When the people came back home, some of them were mad because we cut down the trees and we cleared out the town. We had to do that to protect our community. Could you imagine with the force of the people to come together to protect our community now with the crisis that we have, like we did in the community of Fort Chip? And I'm going to say it this way. In the last 3 weeks since the crisis happened in the community of Fort Chip with the gun shooting and the truck burning and everything, we brought the RCMP into the community. We as the community stand firm and we drove all the drug dealers out of our community today. They are running around in the Delta, in the bush, hiding from people. We know that for a fact because these are the reports that we get from the land users. So if you stand firm as a community and you're going to let a bunch of little thugs control your community, think again. When a community stands together, those thugs will run. And if the RCMP are going to help assist us, let's do it, and let's do it together. Because we, the people, know who's doing it. We, the people, have to do something about it. And we, the people, have a mouth in front of our face. Why cannot you speak about what's going on just because it's your family members? Get real. I'll tell you something. Your family members that are selling these opioids to our family, to our people, they're killing our people at a rate that we can't stop. And yet they walk around our community and hold their head up high like they're doing a big favor to everybody. They're not. And these are our family members. And if we're going to run from our family members, think again. I'm not going to be scared of them. I'm not scared of anybody. I'm not scared of a wildfire. I'm not scared of death, if I have to put it that way, because ever since I became the chief of my nation, I said it straight out back then. I'll say what I have to say because our community was suffering back then from the cancer crisis. I am a walking dead man already. Now speak the truth and tell the truth, because all this has to be revealed, and let's do something about it instead of making it continue to happen as we do today.
Thank you. And then my follow-up question will be for Chief Janvier. This is in regards to, you kind of spoke on the Indian Act and how it basically, like, every move that you do is like controlled and everything, like, it's kind of watched by the government. I was curious if you believe that the removal of the Indian Act would assist you in addressing this crisis.
Hello. The understanding that everybody has to have, we made a treaty with the newcomers in this land, with the British government. That treaty, after it was made, the Indian Act was created. The Indian Act was created so that the government would look after us, but it's not. It's a tool of control, and everything that we do is under the Indian Act. It is an act that says basically we aren't human, that says we can't look after ourselves. But those days are long gone. The way that Canada has to deal with the Indian, we have to wipe out the Indian Act. And then we have to go back to the treaty. The treaty has very simple ways of dealing with everything, and it talks about sharing. But the government and its whole system has to be changed. That is why the fear the government has of going back to the treaty to deal with us. The Grand Chief, I would really like the Grand Chief to speak to this matter, because he's dealt with it for a long, long time, and his father, and he has really more good words to describe, because he comes from a higher level of dealing with chiefs on a different level.
Thank you, Chief Janvier. I guess I thought you got to go to dates and times. I guess in the past, 1493, we reiterate that the Papa Bull was there for that the First Nations in this place were considered to be animals and savages that not worthy of life. Weren't considered humans. So 1763, King George III stated that those Indians are owners of the lands, make treaties with them. So what we didn't know at the time was, after that statement was made, there was an Indian Act created in 1867 that basically created the suppression of First Nations, way of life, livelihood across the country. And Treaty 8 was entered into in 1899. And just a bit of the history of the treaties. Treaties 1 to 11 were created in 1 to 7 in 7 years. Treaty 8 came 22 years later. Why didn't they follow up with Treaty 8 right away? Because the people didn't want treaty. But they were, what the treaty stated was they were molesting the settlers and the miners, killing them. So the government, that be at the time Northwest Territories government, lobbied the Dominion of Canada for another treaty, Treaty number 8. So when we entered into Treaty number 8, there was no mention between negotiations of an Indian Act, that we have to act a certain way. And so when we entered into treaty, province came to be 1905, and the 1930 Natural Resource Transfer Act, that was another bit of history that many people don't know. Prior to the 1930 Transfer Act, the Mikisew Cree First Nation, when they pushed the case for traditional land use consultation, that we came across documents stating that in the 1920s, 1927, that the provinces were writing to Canada, stating that, you know, we need help. We need to manage the resources because the First Nations people own the resources. And we are now basically in depression because there is no way to make money. So they lobbied the Dominion of Canada for the provinces to have control of the resources. Without the First Nations that entered into the treaty being, you know, consulted, these transactions happened. So ever since the 1930 Natural Resource Transfer Act, they've exploited our resources and they left our First Nations people out, suppressed by this so-called Indian Act. So I agree with Chief Janvier when he says, do away with the Indian Act, honor the treaty. It'll be a different future and a brighter future for our people. Thank you.
We will now take questions from media joining virtually for one question and one follow-up at a time. Please also identify if your question is to the whole panel or to a specific person on the panel. And we will begin with Alana Smith from the Globe and Mail.
Hi, thanks for taking my question and thanks for having us today. I think my question is for Chief Adam. It was something that you had mentioned earlier. You said that there has been conversations with municipalities, the province, and the federal government. I wonder if you can provide some additional details on how those conversations have gone and if there's any indication that additional funding will be provided by these governments.
Based on our conversations, we just had a meeting yesterday with the provincial government, and we addressed the issues that we're having, and slowly we're bringing in other agents to help and assist with what's going on in our communities. And we're also letting the officials know of the need of what's going on. And it's encouraging to hear that the government of Alberta is actually looking towards the Athabasca Tribal Council for remedies of how to assist with the opioid crisis that's going on in Alberta. So we have an opportunity here to do something right. We have an opportunity to correct the problem that was created in the past, because all of Alberta and of Canada is watching us. Like many times before, as my reign as the chief for the last 16 years, I've seen the regional wood buffalo come together in strength and numbers with the Athabasca tribal leaders, that we could do this. This is within our grasp, that we could grab it and hold on to it and say, let's squeeze it out. I know that for a fact. I'm a firm believer. And I believe in the people. And I know for a fact that they're crying for help. And when help comes, they will take it and they will run with it. That's why I'm asking for the agencies to help and assist us. And we could overcome this problem together, not as individuals.
Thank you. And then I had a follow-up question, but also a clarification. The follow-up question is there a specific amount of funding that the community is asking for? And then for clarification, I know you had said earlier that the council had wanted to announce the state of emergency in June, but it was delayed until now. Can you just explain what that was?
When you listen to Chief Janvier spoke earlier that every month that they alone spend over $200,000. And when you look at that, you ask yourself $2.4 million times 5, because there are 5 First Nations. And let's just put it that way. So there's your number.
Next to Sarah Ryan from Global News. Please go ahead.
Hi, thank you so much for taking the time to speak to us today. first, a bit of a follow-up maybe to Elena's question. I'm just hoping you can explain a little bit about, exactly how much money you're looking for from each level of government and what things that money would buy in particular.
Thus far, I think the Athabasca Tribal Council received over $100,000. 1.2 million. So far, since we've raised this issue, we probably raised $1.3 million. And that's not enough. That's just tip of the iceberg. When you talk about people in need of crisis, just take, for example, when our community was evacuated, we ourselves from a nation, we spent $1.6 million to assist our members that were left out of our community. The people from up north that have been evacuated, we are spending over just about catching up to $1 million alone just to assist and obey them. And these numbers are crazy. Could you imagine how far that 1.6 million is going to go when 5 First Nations are in crisis?
Maybe if I could add a little bit on to the comments that the chiefs have offered in terms of what are the asks that the task force and the board of directors and chief and councils have identified. So the mandate really focuses on a number of different areas which need to continue to be worked on and built out over time. But because we are dealing with many of our communities that are struggling with such deep levels of addiction and mental health issues, we need in our region timely access to detox and treatment centers. Right now within Alberta, to send someone to detox and then off to treatment, it often is a cost of upwards of $50,000 per individual. Often when people are seeking treatment, it takes many attempts for that person to get into a space that they're able to stay on a path to wellness. A lot of those times, and almost every one of those times, our members have to leave this region. They have to often leave Alberta to be able to access treatment and detox services. And that is not something that we want to continue. Our people have had to leave their homes to attend residential school. When they want to heal, they want to be home in their home communities. And so we would like to have partnerships with the government of Alberta and with Canada to ensure that we have access to detox and treatment centers here in our region. We also know that many of the different treatment centers that are being committed to with Alberta right now, there is no source available to us that has the Dene and Cree cultural teachings and practices that we need built into recovery. And so that is another aspect that we're looking in terms of a partnership and commitment to. The other areas that we really want to focus on from a First Nation perspective is that a person can work towards getting clean through treatment, but that's only one step. Really, the major focus for our communities is that there needs to be a safe space in our First Nation communities where people can return to, that they can be supported in to be able to continue their healing path, whether that's through counseling, working with elders, working on the land and living in our traditional ways, that our youth have the ability to participate in sports activities, that they have ways of living in a good way that keep their mind clear, keep them active, keep them positive. And so a lot of those pre and post treatment supports need to be available in our communities. Each one of our First Nations have traditional territory where they practice these activities on the land. We need additional resources to continue to build that infrastructure, to hire our people so that we can continue to pass on the language, land practices, and knowledge that our elders have held for generations. All of these come at a cost, and all of these need to be done at each community level as well as an opportunity here in Fort McMurray. I think one of the other areas that we've talked about is we are often in crisis. And so when we are in crisis in our communities, we need to be able to support each other with people that can listen in culturally relevant and respectful ways. We need our elders to be able to be supported to support our people in ceremony, in practice, in the ways that we know really resonate with our land users or people that have lived off the land for generations. And so having those mobile health crisis units that can go out and really just sit with people and listen and allow them to speak and to be heard and to be validated. Those are the types of things that we need available in our region, and they cost. I think I heard statistics around a psychologist is something like $250 an hour. If you think about what we need in terms of elders being recognized, our counselors being recognized at that same level so that we can have those resources at a community level, it adds up. We've also heard from Chief Janvier about the need to ensure basic needs are covered. For anyone who has ever experienced addictions within your family, you know addictions do not just affect the person who is dealing with alcohol, drugs. It affects an entire family. And often that family is struggling to meet basic needs on a day-to-day level. The job that these chiefs and councils have to support their communities to ensure that children are not left without, that they continue to get the support that they need to be fed, to be housed, to get an education, to be able to go to their sports programs. These are the things that they ensure are happening within their communities at their own cost. And they will continue to provide those supports, but we are looking for partners. We are looking for government to stand beside us and to commit to long-term sustainable funding so that we can work with community to ensure that there's a path forward. Thank you.
Thank you. And for my follow-up, Carla, I might continue with you because you still have the mic. You had said that you guys are seeing a significant rise in violence and crime from people outside the region coming to prey on the vulnerable. Can you elaborate on that, please?
I guess with the recent activities that were going on in our community, you know, we have these drug dealers that are known to us. And they bring their friends to the community. And these guys are not even community members. And they plague on us. I imagine that every other community that feels and suffers the same thing, there are people in our community that are harboring these individuals. You got to remember one thing, the opioid crisis, it's got its own revenue stream. It's got its own mechanism. They have their own economy. Could you imagine if us First Nations had that resources that the drug dealers have? I'll tell you right now, and I'm going to be honest with this. There are two drug dealers in our community, two gangs, fighting over the resources that our community provides. And I'll tell you this, and I'm not going to be ashamed of it, because I believe that the drug dealers make $17 to $18 million from our community alone on a yearly basis. I wish our First Nations could make that much money. So this way we would have a better understanding how we could combat these things. And we allow this to happen because people don't say nothing. We as leaders, we're busy all the time. If I seen a drug transaction in front of me, I will phone the RCMP and deal with it that way. But most people look and turn a blind eye and walk away and say, as long as it doesn't affect my family, I'm okay with it. But that's not the case now, because we're all affected by it. Every one of us. And the violence has to stop. And like I said earlier, when they were shooting guns in the community, setting vehicles on fire and still doing what they did, and when we clamped down, The community members were not running anymore. It was the drug dealers that ran. One of the guys went back to Saddle Lake. I know where all these guys are. I know where they went because I'm being told these things. 4 of them are running around in the Delta right now, scared because of the community folks. They don't want to get shot at. All the things that they plagued on us, now we push back. And when we push back, where do they go? They put their tail between their legs and they run because they are scared now. All the things they did to our community, now the community is taking back action. And we're not going to stand for this. When I went home the other day, I was told that there is no opioid in the community. The people that were on it are having a crisis of their own because of detox. Could you imagine them going through these things because of what we're doing as leaders to protect our community? There are groups of people in the community that are suffering today because they're urged that they want something to fix their problem. And we as First Nations leaders, we can't fix that problem for them. We can't go up to them and say, here, this is for your problems here today. But we have help, and there is help out there. And we know that this could be dealt with in a way that's going to help everybody. You know, and I feel sorry for the people that sell it to our people in the community, because if that's your only means of resource for financial security, I can't imagine what you go through every night when you go to sleep, ruining the lives of many people and ruining the lives of many kids and taking the money that we're supposed to provide to feed our kids. And I'll tell you this, we as grandparents, we continue to provide for our grandchildren because we know what's going on out there. And we see it. And if it's going to be left in the hands of our young people today that are between 20 and 40 years old, in 10 years, 20 years, we'll be more of a dire crisis than we are today. So just understand that. What was predicted 20 years ago is in full force today. In order to turn back the time, we have to look back what happened then to correct it. And believe me, with all the information that we have, Chief Vern, myself, and Chief Neil came into it. We know what has to be done within our community because we see it all the time. We hear it all the time. We hear it from everybody. I myself go and talk to a user. I myself go talk to the drug dealers. I myself talk to the drug dealers that were shooting the community up and try to tell them to smarten up because we don't need this in our community. That's what a leader does. And that's what a leader should do. Don't be scared of these drug dealers. Meet them head on and talk to them. Because if we don't, then we are part of the problem.
We now have Julia Wong from CBC News. Go ahead, Julia. Julia, we're not hearing you. If you can try again. It appears we're not getting Julia Wong from CBC News. We will now move to questions from the community and closing remarks in Fort McMurray and return to Julia if we're able to get her going.
Yeah. So if any community members have a question you'd like to ask of the members of the panel, feel free to come up to this mic and use it right now.
I have a question from one of our social media outlets. This is from Sarah Auger. Will your task force be considering harm reduction measures such as safe supply? I lost my son, a Mikisew citizen, to fentanyl poisoning last December. I wish I had been more knowledgeable about what supports exist and can exist based on evidence-based practices. I would have approached my son's drug use and what he needed differently. Maybe he would still be alive today.
You know, as community leaders, we look at all the options that are provided to guard our community members. And we're doing everything possible through education, through experience, and making sure that we get the message out there. And it's hard to talk about an issue that we as chiefs shouldn't be dealing with. We have other things that we have to provide. We have to build our community. We have to build a structure that's going to help support the community. And yet we have these issues with opioid and fentanyl. And it's getting carried away where now I am very worried about the fact, because I see things. I see the people that are on it downtown. Many of you see it as well. They're doing things that are harming themselves. And yet we, as people, we can't even approach them because we don't even know what kind of harm they're going to do to us. You see them flopping over, staggering. No conscience in their mind. I don't believe that the opioids that are out there with the cocaine and whatever, those things alone will not kill the people that the way it's killing them today, because of the mixture that it's being cooked with the fentanyl and everything. These are the crises that we're having. The coke that was probably back in the day, from what I experienced talking throughout other people, I myself never used it. But just by the fact about them using it from the past and today is worse, because they're mixing it and they're enhancing it. And when the people say somebody went through an OD, you want to know something? All the users run to that drug because they're looking for that high. I know that for a fact because my nephew, the one that passed away just back in July, I was told that he OD'd probably about 60 times. And every time he OD'd, his friends would call the ambulance and they'll give him what they call, what's that thing called? For that shot. Naloxone, whatever, and stuff like that. And when he came through, he got mad at one of his friends and said, "Do not give me that because it ruins my high." His friend had to take a video of him when he OD'd just to show him what he had to go through to watch him do this, and he had no choice to give him that shot. Only then he realized what was going on. But unfortunately, he didn't take it to heart because he himself passed away this summer. So those are the kind of crises that we have in our community.
All right, we're going to return to the Zoom because I believe Julia Wong from CBC has fixed her audio. So Julia, you have one question and one follow-up.
Hi, thank you. I'm hoping you can hear me now. This is a question for Chief Alan Adams. You made mention during your comments that Indigenous Services Canada is not providing enough funding. I'm just hoping to get some clarification on how much specifically you were asking for and how much was being offered.
We've been offered $1.2 million thus far, plus $100,000 in the last 3 months. Our ask for our help here in this region probably is going to stem probably about $20 million. And that's not even the tip of the iceberg. That's just the bare minimum of what we could see, how we could address this issue. Because we have no treatment center, we have no detox center, we have nothing. And yet, we live in an area of the world's largest industrial movement, with billions and trillions of dollars being spent here. And we can't even build a drug and alcohol facility for one of our members. What a shame. What a shame we have to live with. So I'm asking industry, the municipality, and the government of Alberta and Canada to step up. With the trillions of dollars you've taken from our resources and from our lands, you give some of that back to help our people. And like I said earlier, if not, get out of here.
Thank you. And my follow-up is also for you, Chief Adam. You know, individual declarations of state of emergencies have been made. What difference do you think a regional declaration will make? And is this born out of solidarity or is it born out of frustration?
When you take it from a holistic approach, when you stand together and you say we have an issue, we have an issue. From a community's perspective, and saying that we call it from a community's perspective, it's because others don't want to step in. We have 5 First Nations here in this region. We have 3 chiefs here, and we have the Grand Chief of Treaty 8. This is a crisis. And we need to band together. And we have to come together as one. This is why we are here today, because we know the importance of this issue and what it's doing to our people and what it's going to do to our younger generation to come. And if we don't get a grip hold on it, it's going to destroy our people. And we cannot allow that to happen.
All right, we'll return back to the community questions, and I think we have a few people online.
Gunsay, Stephanie Harper, Fort McKay First Nation, as an advocate for the country, as an advocate for home region here, doing this work for 11 years and, you know, being here. I just want to start off by saying something to the media. I've been in rooms with government, I've been in rooms with media, I've been in rooms with, I've been all over with the United Nations, I've addressed the whole world, okay? As a survivor, as an advocate and a family member, media, you're asking the wrong questions. You're talking about money when you're not talking about the trauma of human beings, period. So I just want to say that to all you media. First of all, you're asking the wrong questions. And you have to remember, everyone has to remember, a country and a church and the military did this to our people. It is an agenda. It is alive and well with the racism, the oppression, the genocide is alive and well. And this country has profited off the suffering of our people forever. And to get the monies that we're receiving is a slap in the face. It's a slap in the face. And they don't want to fix anything because they profit off of all of that, off that suffering, all that revolving door. They profit, they profit, they profit. The one thing that I need and the team and the task force and the region need is more supports to help those people that are privately suffering in their addiction to come out. I've been to all the communities, I've been everywhere, and the problem is the attendance. I need them to come out. When we come, we need them to come. So I just need help with that, and thinking of brainstorms in that. Right now, a lot of private one-on-ones. I'm doing a lot of private one-on-ones in the region, and that seems to be working a lot. So I'm gonna, I just want everyone to have my information. They are scared. They are scared. Everyone's scared to use their voice. But now is the time to use the voice. Now is the time, because we have organized crime syndicates profiting off the death of our people, okay? Which is a safety issue, But we've lost so many that we have to do something. We have to do something. And, sometimes we jeopardize our safety in this, but who else do we go to is going to stand up and protect us and serve? Like we're not getting seen as the first human beings of this country, period. We are the first human beings here, and we need to be treated as so. And I'm sick and tired of people comparing their trauma to ours. It is different. It is way different. It is so multiverse different. And the addiction is pain. So what is the pain? What is that pain? That's where we have to go to, the rooted pain, the deep. So going back to that fractured child. I want to thank Fort McKay First Nations. I want to thank Athabasca Tribal Council. Elena, you brought me out here years ago. I want to thank my nation for hiring me. I want to thank all of you for supporting me. And I want to thank my beautiful team. My partner, Jess, I love you dearly. So we have to move forward. We are creating action. We do have these things. I am the first person in grassroots history to do a provincial action plan for the National Action Plan of Canada. So I've been to 73 Indigenous communities, and I'm home. I'm here. I just want to do more and more and more. It can be done, but it has to be done through survivor lens. If a survivor is not at the table, this is not going to get fixed. So that's what I ask of you. And media, behave yourselves when you're asking questions about something so horrific, so critical. Okay. So the other thing too is what we're needing, and what I'm not seeing enough of, is the survival hours are not 9 to 5. So 5 o'clock when the doors shut, that's when survival starts, is around 9 o'clock to 9 o'clock the next morning. That is a huge vacancy for our people, 24/7 hour safe space, especially when sexual abuse isn't being addressed, and that is killing our kids too. That is killing our kids too. So for a kid to sleep at night safely, there has to be a 24-hour safe space. I've had really bad relations and really poor actions with government. I've had with RCMP. I'm on the Commitment to Action for Change with the Edmonton City Police Chief McPhee, who is a Métis man. So that was the only reason why I would work with them. But me and Carrie Thomason have been brought to the table, and we made a significant kind of these changes in Edmonton. I'm hoping that that could be done here. This is my home. This is my bloodline. That river is a part of all of us, and we need to protect each other more than ever. But I'm just going to say this. We have to understand the lateral violence is a big part of it too. The separation is a big part of it too. Fighting over funding dollars is a big part of it too. Okay, so right now what we have to do is remember the fight isn't between you and me. The fight is out there with the people that fail us every single day. Masicho, thank you.
I have another question from Facebook. How are you going to address the need of qualified health professionals to address addictions and withdrawal symptoms? Then mental health and having places for Indigenous people to heal in a good way will take place.
I think when it comes to that issue, you got to remember one thing from a community's perspective. A lot of community members don't like talking to community professional help. The reason for that is because they say they go and talk about us when they're not working anymore. They go talk to other people about our lives. And we don't want that to happen. Now we're stuck as a community trying to find help outside of our community. And we can't even do that. And when we bring them in, they say to us, oh, no, they're not good enough. We want something better. I'll tell you this. The best professional help you could get when you're in crisis is from our own community members. Because if they took the initiative to step up, to take that position to help, obviously they've taken that position not to say anything to protect the value of the person's identity and dignity. Because as a chief, we hold a lot of information within ourselves about a lot of people within our community. We don't go out and talk about what we see in our community and tell the people everything. We hold those in. If you trust us as leaders, as chief, to do that, why can't you trust some of our community members that are out there trying to help our community? And talk to them and relate to them about what's going on within your family. Because it's our own family people and it's our own community people that are going to help resolve this issue. And you cannot look at them and say, oh, he's just a blabbermouth. He's going to tell everybody. I don't need help there. I know that for a fact. Because I could read you some of my text messages that I have received in the last 4 days. And some of them relate to that issue. I will not go and talk to the community professional help because they like to elaborate and talk about us outside of their office. And that has to stop. And we have to build community trust through our health organizations and through the professionals that we offer, that they are there to help and protect our community, not there and talk about them behind their back because of the crisis that they have within their own living quarters.
Thanks, Chief. Just to build on that as well, having medical professionals that are familiar with our communities, that are culturally based. We have amazing community members, as you've heard Stephanie speak in the forum earlier today. We have many elders. We've got Mushroom Elder Robert Cree right in front of me here, who have the strength and the ability and the wisdom to support our communities in a journey for healing. We have many of those resources here in the region, and we need to build upon them. We need to support them. We need to bring them into our communities and wrap our arms around them. We also have partnerships within the Fort McMurray region that we're looking to continue to build upon. Most recently, the Athabasca Tribal Council signed an MOU with the Northern Lights Health Foundation and the local hospital, where we're looking at taking over and building an Indigenous health clinic to ensure that healthcare delivery is provided in a safe, culturally relevant manner right within our hospital. This also has to occur in each of our health centers within the region. And so I know under the leadership of the Athabasca Tribal Council Board of Directors, they're committed to making those changes within our healthcare system, because there's high degrees of experience of racism every day that our community members experience. And that needs to change if we're looking at healing. Thank you.
Thank you very much. Robert Cree from Fort McMurray First Nation. First of all, I'd like to acknowledge, and I do have my loyalty with the leadership, all the chiefs. I know what they're going through. I'm a former chief too for 10 years. I know what I went through. I just want to remind the media back some years ago when late Dr. Harold Cardinal was alive. Me and late Harold went to negotiate with the government, federal government, to work on our resource, to have a resource sharing revenue for all Treaty 8 First Nations. We met with them, and it took a long time. And they kept reviewing the document. And finally, Dr. Harold asked him what was wrong. He said, nothing's wrong with the document. It's actually one of the best documents that we ever received. Now, this is what I think the media wants to hear, because in the final discussion, there was a fellow by the name of Walter Rednicki that we had to meet with in Ottawa, but also the cabinet. But when we met with Walter Rednicki in the last day, finally Harold asked him, why wouldn't you sign the agreement, the resource sharing revenue agreement? How come the government will not agree to the agreement? They said, because the first thing you're going to do, he said, first of all, he said, you're going to get not billions of dollars, but you're going to get trillions of dollars by the government, by Canada. And what you're going to do is you're going to go and get your own army, and you're going to come and bomb our government building. You're going to bomb all the provincial legislature buildings. And then you guys are going to take over the whole governance system in Canada. That's what you're going to do. That's why they won't sign an agreement with you. They're scared of us. There's no trust, but yet at the same time, they're reaping all our resources from our lands, from our treaty territory. And what they use is every time you hear resource revenue from the news, they talk about oil. They don't talk about gas or gold or silver or trees or water. It goes on and on and on. I mean, there's multi-billion dollars of money that's being accessed from our traditional lands. That's what's happening, The amount of money that they take from the oil is not enough to supersede the rest of the resources that they're taking off the land. The other thing that I wanted to mention also is that there's always been an agreement between the province and the federal government. There's such a thing called resource revenue agreement that's given to the province in the millions of dollars, billions of dollars. That resource transfer dollars is supposed to be used on our behalf as First Nations in this province. That's to utilize our hospitals, schools, whatever. That's where that emergency dollars should be coming from to help out the First Nations in this region. What the hell is going on with the governments? What is happening with the governments? You've forgotten us for many, many years. Wake up. It's time to listen to the leadership. Time to listen to our people. We just had a young lady that passed on because of opioid drugs. We had a wait last night in our community. It's not easy. These communities are suffering. Our reserve, as small as it is almost superseding the amount of people that die in Fort McMurray. We're in the midst of crisis. We're in the midst of emergency, state of emergency. Do something. The government's the one that controls the funding. Why can't they give some of that money to the bands, to the nations here. Time to listen. Thank you.
All right. Well, thank you, everyone. I think that this brings us to the close of our news conference. Sorry, I didn't see you there. Please come up to the mic.
Good morning, everyone. Good morning, chiefs. Good morning. Welcome to the media, the public, the people. I'd like to thank Stephanie Harp for all the work that she's doing on behalf of people who are experiencing the lives that they must experience in order to deal with the trauma that they have endured. What a critical moment in time. And I specifically am thanking you, Stephanie, because her words are why I'm standing here. She said, we need to have a survivor speak. I'm a survivor. I'll tell you who I am. My name is Shirley. I am the daughter of Rita. Rita is the daughter of Annie. Annie is the daughter of Colombe. And that's as far back in history as I can go. Colombe's husband signed Treaty 8 as the chief of the Athabasca Chippewan First Nation. And that is who I am descendant of. I have children and I have grandchildren. In my life, I have experienced every single bit of trauma that has been expressed by our chiefs. Racism, colonialism. I have been beat by police forces. Horrible, horrible. I can't go any further than what I've said, but the worst that can happen, I have personally experienced. I had nowhere to go, but I had alcohol. I had nothing to do, but I had drugs. And that is where I went. That was me doing whatever I had to do to survive. Needless to say, it led me to the streets. These streets here in Fort McMurray. And occasionally I would go to Edmonton or to Calgary, or I even once went to East Hastings. Crazy. But yeah, these are what I had to do to survive. I understand now that it was a certain death, a slow death, but a certain death. And the worst, at the worst point in my personal history, I was alone. Truly, 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 emotionally, culturally, every which way alone. I had cut myself off from my family because I thought that was the best thing to do. I did not want my family to see me suffering. I had not talked to my children for years. I had a 5-year-old granddaughter whose name I was not sure because I had cut myself off from my family, because that, I thought, was the best way to protect them. One day I was standing outside the casino here. Now, you have to understand, I honestly believe, I don't know, for whatever reason, we end up in certain situations, certain things, and there's a purpose. And although we may not understand that purpose at that time, ultimately there is a purpose. For me, I was in Edmonton. My mom brought me to Edmonton just before I was supposed to go into the residential school system. I was so looking forward to it. I was looking in that window and at those rows of beds. And I was like, yeah, I'm going to go there. She took me and brought me to Edmonton. So I thought, well, that's most unfair. In Edmonton, I experienced degrees of racism, open and blatant racism directed to a child. And it was acceptable amongst everyone. That was, even at that young age, I had already experienced trauma that you would not believe, purely as a result of the residential schooling system, which was purely as a result of genocide, which was purely as a result of governments and entities collaborating to kill us. Each one of these men, through their words, has brought forward thoughts that I've run through my head. Anyway, back to this child, right? So I was experiencing all this racism. I threw myself into my books. That was my escape. I went back to Fort Chip, and I was 13 years old, and the school system was and still is years behind. And so my schoolmates thought I was really smart. I wasn't. Well, I don't know. They just thought I was. So years and years later, I'm standing outside the casino, and I'm at the lowest point in my life. I hadn't talked to my children in years. I literally lived on the streets year-round. And I am telling you this, I did not have a tent when there was in excess of 60 tents up and down this river that people lived in. I didn't have a tent. I didn't even have a backpack with a change of clothes. Everything that I owned was what I wore. Anything that I ate was what was given to me. And that was where I was. But at that point in time, this community was prospering so well that I had never dressed nicer. Unbelievably so. People were giving $60 t-shirts and $100 jeans to Salvation Army, where I could go once a week to get a change of clothes. And so I looked good. You wouldn't think I was homeless, but I was. So I was standing outside the casino, and one of my first cousins comes up to me just as Chief Allen came walking up. So the three of us met right in front of the casino doors. And my cousin says to me, he says, "Shirley, why are you doing this? You're so smart. He said, how come you don't just stop and go? Like, stop, just live a life. Why? And Chief Adam said something that resonated within me. He said, and you have to remember, I had already been out for years and I had no one or nothing. And he said to me, I won't say my cousin's name. He said, right here, right now, this is where we are. You're standing there, Shirley's standing there, I'm here. We are here, right now. We each had different paths that brought us here, but this is where we are. And that resonated with me because we do all have different paths, but we are here now. And there is so many different ways that brought us here. And we need to collectively gather, because it is true. We are in a crisis. We are losing people every day for every single reason imaginable. I hear people talking about resources. In my mind, I don't know where my mind came up with this, but I see two resources, and that's our children and our time. I see those, to me, I don't know where I got that idea, but the two most valuable resources that I can think of are our children and time. And the time is now. The time is now. I don't know why I am still alive when others are not, but I thank the Creator that I am. And I feel so sorry, so sad, so hurt for all that are lost, because many are friends and many are family. And we must step together and voice our love for each other through words, through action, through prayer, through meditation, through reaching out, through a kind word, because I cannot think of any words that I have heard thus far from anyone on the panel or from anyone in the audience that is not a truth. Let's do it for our families, our friends. Let's do it for those who cannot do it for themselves. And just as a side note, yes, I was on the streets. Yes, I was homeless, but I now have my family back. I'm employed. I'm a productive member of society. It is possible to change your life. No, save your applause, your energy, your concern, and everything else for everyone that needs the help coming in. I'm here. I want to be with you. And I thank you, Stephanie, for inviting me up.
Shirley, I couldn't imagine a better way to end our press conference today. I really want to say thank you for coming up and to sharing your story, because your story is so familiar to every one of our community members. We have community members who are struggling. We have community members that have dealt with racism. They're living on the street. They're facing addiction. They want a different life. And I'm really proud of you. There is a reason why you're here today. And there's a reason why our chiefs are declaring a regional state of emergency, because they want that hope, that future to be known, that there is another side to all of this addiction and trauma that our communities are dealing with. This didn't happen overnight. For many years, for many generations, colonization, residential schools have taught us to not love ourselves, to not be proud, to put who we are as deep down and far away as possible. And that's no longer where we're going to stay. Our communities are going to support each other. They're going to stand strong, and they're going to continue to start to share their stories so that we can heal. I think that brings us to a close today for our news conference. It's not the end. It is really just the beginning. And I want to thank everybody that is here today. I'd like to thank all the supporters, our community members, our leaders for joining us today. We are no strangers to the disaster and crisis that our region is facing. And we all know how much it means to have your support when we're calling for help, and for our communities when they want to band together. I'd like to say thank you to Grand Chief Noski and Mayor Bowman for attending, to showing their support today and by meeting with ATC, to the community members, to the elders, for coming today and for watching online and joining with us. Hi, Marcy Cho for coming to hear the community's plans. We have worked together to make meaningful changes in the region. We want to see you, your family, and your communities begin the healing journey, as we've heard Shirley talk about today. And we're here to take action, and we're here to serve you. Lastly, I'd like to say thank you to the members of the media for your attendance today. If there's any further questions, we'd be happy to take them offline, including any of our members of the public or community members that may have asked additional questions. I'll direct you to call in to follow up. And again, thank you everyone for your time, and let's start this healing journey together. Marcy Cho.